So good global health night to y'all. That's right, I'm from Georgia originally. But I've learned to speak more quickly since I left the South. I'd like to share some enthusiasm with y'all on the theme of making a positive difference in the world. We're here tonight to get our bearings, to celebrate inspiration, and to learn. I don't know of a better compass in global health than Dean Al Cooperman. He says not to call him Dean anymore. I'm going to keep calling him Dean, except, anyway, it's a long story, but there he is. He's right there. Within the last 5 years, global health centers have mushroomed into most U.S. universities as those places look to capture new research funding and surf the student interest wave. But to quote Barbara Mondrell, Al was global when global wasn't cool. Like that. I told Dr. Hawkins I'd sing tonight. She's apparently going to sing some too. Dean Cooperman came to Einstein 35 years ago with a stipulation that our institution commit to sharing its student resources with the world. In that process, he also made the world into an ACOM classroom, creating the Global Health Fellowship and setting the bar for global health education excellence, at the same time building the foundation for our current Global Health Center. I'm going to quote him. While educating future physicians who will practice the most competent and compassionate medicine possible, we also have the responsibility to create future leaders, students who want to change things, not just within a discipline, but the way healthcare in general is practiced and distributed and paid for. We want our graduates to be catalysts for social change, dealing with problems and issues such as health disparities, the public health impact of climate change, how we care for the frail elderly, physically disabled and chronically ill, and access to affordable health care for poor, underserved, and marginalized populations in local communities, in communities across the nation, and in nations beyond our borders. To achieve this goal, we need to develop a parallel or co-curriculum that encourages students to look beyond their courses, classrooms, and clerkship sites and acquire experiences that enable them to expand their knowledge of medicine in the broadest way possible with open hearts and open minds. It's a very profound guide that we have here. Now, ACOM commitment to and support for global health education makes students at other institutions jealous. I don't know if any of y'all have experienced that. It can't be bad for recruitment that that's the case. But it's Dean Cooperman's legacy of learning while serving, of social justice action, a pedagogy of hope, subtly crafted, that has brought Albert Einstein College of Medicine esteem in the eyes of persons around the world doing daily work where life is not taken for granted. Raja Rowley of the Jamkhed Project in Pune, India, said it straight. Global health is hard work. Its practice is not glamorous or titillating. It means working with poor people who have difficult lives to create with them better lives. Now, there's a spectrum of what some people mean by global work in the health field. There are scenarios where one can work outside of the United States for transnational corporations, including those within the pharmaceutical and insurance industries, and make fabulous profits in the continued mining of third world resources for the industrialized world consumer or shareholder. This is a development, military, industrialized complex also that supports globalization in its most corporate lust for profit, sometimes doing so in the name of doing good. And they seek doctors too. But there are also persons who use their talents and energy to work with communities, universities, local organized groups, and other entities, including on occasion governments, bent on making a positive difference in the world. Under Dean Cooperman's leadership, Albert Einstein has allied itself with and its faculty and students have been drawn toward and been part of this cadre of persons and groups dedicated to positive change. Let's leave the room for a minute. So here's a photo made in a Village Health Works project in Kigutu, Burundi. Now, Burundi vies with Sierra Leone in being the poorest country in the world. The littlest baby that you see right there, can you see a little baby right in the middle? It's you know, kind of, I'm supposed to, I've never been able to do this before. 2, right? Okay. I couldn't resist that, y'all. This little baby is named Bikorimana. Bikorimana. That means it is being done by God. This baby was born 30 minutes prior to this photograph, had an APGAR of 7.8. No, it was doing well. The picture itself was taken in September. Now, the maternal mortality in Burundi, what does maternal mortality mean? Does anybody know? It means women who die when they're giving childbirth. It's how many women die out of 100,000 births. So does anybody want to guess, or is anybody informed at what the maternal mortality would be in Burundi? Don't be shy, please. I'm not grading you tonight. 1,000 is a good thing. It's actually 1,100 officially. Think about that. Yeah. The lifetime risk of a woman dying in childbirth in Africa is 1 in 26. 26 births, a dead woman. In Niger, it's 1 in 7. You don't want to get pregnant in Niger. You certainly don't want to give birth there. If you get pregnant, go to a country next door. It's a terrible thing. It's a terrible thing to be a woman and be pregnant in Africa. Any of y'all who've ever had a friend that had a C-section or got blood or antibiotics, you know why these women die. Because they don't have those. By the way, Ireland's lifetime risk of having dying in childbirth is 1 in 48,000, just for comparison. So I actually have this thing. It's got like a trigger. It's called a gatillo in Spanish. Let's see if it works. Nope, that one doesn't work. That one does. So Tracy Kidder, who wrote Mountains Beyond Mountains, which many of y'all have read, and if you haven't, try to read it before Monday when Paul Farmer comes here, so you can have some intelligent conversation with him. Now, he'd prefer that you read Pathologies of Power, which is one of the books he wrote, not a book written about him. He wrote a book called The Strength That Remains about Deo Gracias. It's about the Village Health Works project. I recommend to you the reading the project and the concept. Anybody know where this comes from? Been to Boston? You've been to the Holocaust Memorial? Can everybody read that? So I'm going to, these words resonate with me, right? They came first for the communists. I didn't speak up. I wasn't communist. Came for Jews. I didn't speak up. I wasn't Jewish. Came for the trade unionists. I didn't speak up. They came for the Catholics. I didn't speak up. And then they came for me. And by that time, no one was left to speak up. Martin Luther King said, as long as there's poverty in the world, I cannot be rich, even if I have $1 billion. Dr. King was from Georgia. As long as there are diseases rampant and millions of people in the world cannot live more than 28 or 30 years, I can't be healthy. Even if I just got a good checkup at the Mayo Clinic. I can never be what I ought to be until you are what you ought to be. That's the way our world is made. No individual or nation can stand boasting of being independent. We are interdependent. Now, in El Salvador, there's a river called the Tarola. It's a place where many student generations, I call them, of Einstein folks have global health fellows have swum in and worked near. It's a river currently threatened by damnation. And I want to show y'all some of these folks who have been here before. This is Steve Miller. He was the first person that Jerry basically introduced me to Steve. Steve had a great sense of humor. He still does. He had no experience in international health, but that sense of humor and a humility stood him really well in his year in El Salvador. He's now an emergency medicine attending at Highland Hospital. He heads their international program. I just want to give you an idea of possibilities, what the Global Health Fellowship can do for you. This is Seiji Hayashi. Seiji is a class of 97, and he's now the Chief Medical Officer for the Bureau of Primary Health Care at the Health Resources and Services Administration and the Obama administration. As you can see, it's the federal agency that runs the Community Health Center program to improve health access for poor people. Go to him for your funding and say, hey, we're colleagues. Next comes Julie Ta. Oh, here's a picture of him at the recent Doctors for Global Health session in D.C. Next comes Julie Ta. So each of these people came and they spent a year in El Salvador working with the communities, seeing people in the clinic, working with health promoters, doing epidemiology. Julie is now she was a chief resident in Bellevue's primary care internal medicine program once she finished here, and now she's the director of the Center for Integrative Healing of Inglewood Hospital. Now we have Leah. So Leah, I have a picture of Leah and I couldn't find it, I'm sorry, because she's sewing up the throat of a pig, a little piglet. And it's predictive because then she went on to be a breast surgeon, and that's what she does now. She was chief resident in her surgery program at Beth Israel Hospital. And then we have Andrew Schiavone, and you can read up there. He's working in a place that's dedicated to caring for people who are underserved, and they're doing it in a way that brings dignity with people. He's a family medicine doctor, specially trained in OB. And he's the one, this is his handwriting, that wrote this sign. I took this picture in 1998 when the World Bank was trying to do a project that would have dammed all of this, all of the area where I lived and where people were struggling for their health in Morazan, El Salvador. That's his handwriting. And you can see from this picture that not only is there not a dam there, but the community's built a whole bridge. Apparently that's going back. The community's has built a whole bridge that I didn't even know about until I got there. They said, we got a surprise for you, Lanny. This huge bridge. I want a prize for it. It's amazing what that community is still doing. I want to close this opening by exploring two concepts. The first is a solidarity versus a charity model. Now, with charity, one gives away what one doesn't need or want to those less fortunate. It's a model born of the, quote, white man's burden, of colonialism, and a sometime public health hubris that assumes communities and people in the developing world are ignorant and have nothing to offer besides their natural and human resources for making money. In a solidarity model, the assumption is interdependence, the clarity that we're all in this together. Where between World AIDS Day, December 1st, and Human Rights Day on 10 December, one important example of the solidarity model is how AIDS activists from the industrialized world, such as ACT UP and others, including many people living with AIDS, especially gay white men, worked together with health professionals, such as the late Dr. Alan Berkman, to force the U.S. government, remember President Reagan wouldn't even say the word AIDS, to force the U.S. government to first recognize AIDS and then provide resources for people with AIDS. And then the next step, that those same rebellious gay middle-class men and health professional coalitions joined with their sisters and brothers worldwide to demand antiretroviral access globally. And now that that's on its way, they're joining with primary care activists to demand health for all globally. The last concept I want to talk with you about has to do with the syndromes of being overwhelmed into inaction by the burden of misery affecting so many persons in the world. Alta alegria, literally translated as high blood happiness, was coined by Dr. Julio Monsalvo of the People's Health Movement. Most of his friends were killed in the dirty war in the 70s in Argentina, and he was tortured. But somehow he has, working with an indigenous Argentinian community in Formosa and using the concept of the earth's physicians, endured. Not only that, but high blood happiness is a measure of the energy, the positive energy that we can have and share with people. What I want to say is that the excuse of being morose, because of terrible injustices afflicting so many in the world, is a luxury of the middle class and the rich. Poor people have to struggle just to survive. And if our goal is equity, we have the chance to work together in community with them, sharing their resilience, sharing with them the alta alegria of being human and being alive. Sierra Leone, the other poorest country in the world. Anybody want to guess what the maternal mortality in Sierra Leone is? You can add 1,000, inexplicably, you can add 1,000. It's 2,100. It suffered a lot of horror, you can see from this woman. Yet here's a woman demonstrating a clear sign of alta alegria. You can see her together with Dr. Baylor Berry, who saved her life, all within the National Organization for Wellbody and its Global Action Foundation, a project begun by Albert Einstein alum Dan Kelly. Now, Dan will be friend and fundraising this weekend in New York City if you get a chance. Meet him if you can. His enthusiasm is infectious. And the program he is developing together with war survivors and their families is extraordinary. It will make you even prouder of ACOM's legacy. You'll see many examples tonight of Albert Einstein College of Medicine engaging difficult situations with action solidarity of alta alegria. Thanks to all of you who walk the walk toward global health. We cherish your inspiration. Thanks.